Hello, my name is Lindsey McConnell, and today I will be presenting about motivational interviewing to treat alcohol use disorder. To begin, alcohol use disorder is categorized by the inability to control drinking due to either physical or emotional dependence on alcohol and can be diagnosed at 3 levels: mild, moderate, or severe. While there are many influences to alcohol disorder, there are 3 specific to this study that increase the severity of my participants' diagnosis. The first being genetics and having a predisposition to alcoholism. The second being mental illness, because often AUD is diagnosed with other mental health issues because not only do they share the same genetic markers for these diseases, but typically alcohol is a common coping mechanism for depression, anxiety, and bipolar disorder. The last influence being homelessness, because not only are some instances of homelessness caused by alcohol use disorder, but also because of the inability to maintain a job or housing during this time. It can also cause AUD from the stress of the living conditions while being homeless. Treatment barriers that are often associated with alcohol use disorder include incarceration, because typically there are no formal treatment plans offered in prison. Homelessness typically means no regularity in visiting a professional, as well as lack of insurance to pay for services. And finally, the severity of other comorbidities can cause a larger challenge to treat alcohol use disorder. Treatment options include Alcoholics Anonymous, cognitive behavioral therapy, and motivational interviewing. For those not as familiar with motivational interviewing, I have the 4 steps pictured below, and it includes engaging with the participant to create a supportive relationship, focusing the participant on what areas of their life are causing them issues, evoking the idea of wanting to change these negative behaviors, and finally planning steps to accomplish these changes. The current study hypothesized that using MI will encourage the participant to set and achieve goals that will lessen their consumption of alcohol by making strides towards things the participant specifically wants to change. The steps needed to accomplish goals will take away available time for the participant to drink, which will decrease alcohol consumption. The goals specific to my participant that he wanted to focus on included getting his GED, acquiring a license, and decreasing his consumption. The methods of this research included a participant that was a 32-year-old male worker at a hospitality center in Wisconsin. The hospitality center offered homeless services such as meals, clothing, and community service options for jobs and housing and other specific needs. The research design included an A-B design, A phase being baseline and B phase being intervention. The variables included the independent variable of motivational interviewing and the dependent variables of the amount of alcohol consumed and ability to achieve goals. The procedure of this research had the participants self-report alcohol consumption to the researcher and was asked not to change typical habits during baseline. Once intervention started, the participant continued to self-report consumption and would have 15 to 20 minute sessions with the researcher to work through the steps of MI and set SMART goals to work on before the next session. Goals were tracked by the researcher. Here I have the results from the research. The graph is showing the amount of alcohol consumed in relation to goals accomplished. The left side of the graph shows data reported during baseline. The mean consumption during this time was 89.07 fluid ounces, and the trend line shows a positive skew, meaning consumption was increasing. On the right side of the graph shows the intervention data. Consumption during time decreasing, the mean during this 75.1, and some of the data points were below all the ones during baseline. I do want to note that points 8 and 9 were particularly high because of a family emergency which caused my participants high level of stress and placed him around family members that also struggled with consumption. If these 2 data points were taken out, the mean consumption would decrease to 47.62 fluid ounces. Out of the 12 days in which goals were accomplished, only 2 days was the participant not able to achieve a goal, meaning that goals were achieved 83% of the days. The results of this study support the hypothesis that implementing MI with SMART goals will decrease the consumption of alcohol. This was seen through the lower consumption means and the achievement of goals 83% of the days the participant and the researcher met. Strengths of this study included a strong connection between the researcher and participant that was established. During a discussion after intervention had ended, the participant expressed a large amount of gratitude and said he wanted to continue focusing on achieving the goals until he was able to get his GED, license, and ability to control his consumption. Meaning that this intervention can be maintained long-term because it set intrinsic motivation within the participant and gave him the encouragement to accomplish things on his own. The second strength is that if additional support was needed, the director at the hospitality center can continue to implement MI and refocus the participant because it requires little training. Surprisingly, one limitation I faced was football season. My participant was a huge football fan, and when the Packers played, he would watch their games and typically consume alcohol with friends or family member. This social influence did increase his consumption somewhat on the days where he was watching football with them. And then another limitation I faced was minimal MI training. And while this I did struggle sometimes with what to say to the participant or how to help them with the next step, but this can also be seen as a strength because with my minimal MI training, I still was able to produce results that were significant within the participant. Implications of this study means it can be applied to specialty settings such as a hospitality center, homeless shelters, and other locations that handle populations that have very little support or other options in treating their mental health disorders or alcohol use disorders. Meaning in the future directions, it should be studied with other diagnoses such as drug use, smoking, or even motivation to apply for jobs or housing. Thank you.